What's up, everybody? It's your girl El Rochelle, the Hardwood Diva, and I am here for my Diva Mommy Dish. We are on week 23. I cannot believe this time is going by so quickly. I don't know. It's crazy to think in 4 months that we'll be welcoming a little bundle of joy. But yeah, there we have it. So far this week, in the way of symptoms, I'm starting to feel bigger. I know everyone doesn't necessarily think that I look big, but I keep reminding people that I have not gained a lot of weight, but I've gained, but it's like all going to the baby. So my stomach is definitely feeling heavy. I'm feeling off balance a lot of times, so I have to have hubby help me up, get me out of the car, help me do this. And he's just like, "You're not that big." And I'm like, "No, I know, but like I'm off balance." Like it's just very difficult to describe. But overall, still feeling well. Not too much in the way of any severe or serious pains. Back pain is kind of starting to come in where just after a long time, maybe walking for a while or just being up and about and a lot of movement, then I kind of get a little sore, a little achy, but nothing extreme. I still take my daily walks at work. I walk 5 days a week usually. Walk for about 35 to 45 minutes. Just depends on how quick I'm moving, how the day's gone. If I start off too fast and like when I'm rounding the end of my little route, then I kind of slow down. But I've been doing that and everything. Kind of still doing well with that. Last night went out for a couple of birthday celebrations. So I was really surprised at myself. I stayed out till 1 a.m. or actually almost 2 a.m. So I'm really proud of myself. Like I did really well. So that's kind of been the fun of this week. Definitely feeling him moving, hiccuping, whatever it is that he's doing in there. Muscle spasms that are punch, kick, punch, kick. Definitely feeling all of those. We'll be going for our 24-week appointment next week. So we'll just hear some, more good news and see what they're saying at my midwife appointment. And speaking of the midwife, that's kind of what I wanted to talk about this week. This week I wanted to talk about making the decision on your prenatal care provider. So initially we started off with an OB. And I started off with the OB just because of a couple of the things that had happened prior to getting pregnant. Some of you may know the story that I was told that I had a condition called endometriosis, which kind of works against getting pregnant. And so I went to the specialist, OBGYN, who just kind of let us know when we were looking through things. He was concerned. He was, believed that we needed to have surgery. I was not in any way wanting to have surgery. So my husband and I prayed about that, and we found out a few weeks later that we were pregnant. So no more of that. But with that, we had started seeing the OBGYN. He's actually a family friend. He's delivered pretty much all of my nieces and nephews. So it was kind of like, well, clearly you're going to go to him. We went to him for a bit, but hubby and I had to make the decision on our own what was going to be best for us. So the decision, of course, now these days comes down between an OBGYN, which is a traditional doctor, obstetrics and gynecology, the OBGYN part, and they're the doctors that are there to check mother's health and then also are specialized in checking for prenatal baby health and actually delivering babies. But then we also had the choice of midwives, and within midwives you have just like a certified nurse midwife, which is basically someone who's an RN that becomes a midwife, goes through extra training, becomes a midwife. Then you have the midwives that are licensed practitioners basically, and all of their care has been as midwives. They've only worked in helping mothers and in delivering babies in their prenatal care. So the decision we had to do was finding that out, and it actually took us almost 2 months to make a final decision on what we wanted to do. We decided to go with a CNM, which is a certified nurse midwife. She's got great reviews. People ask how I chose. One of the first things I did, this in our day and age and how we're very, very interesting you know, internet and review happy, I went on Yelp. And I went on Yelp more to see who is out there and look at reviews, but not necessarily base everything on reviews. But once I got there, I actually saw so many reviews on each birthing center and nurse midwife that I said, okay, well actually this might be a good way to get some ideas. So we looked in our area. There were a few nurse midwives that operated outside of hospitals. We're not going to be doing a hospital birth. We want to do a birth center birth. So not just a natural birth, which I let you guys know about before. We want to do something that is a little more matched with the comfort of home. So we're doing a birthing center. And that was just kind of another decision that we had to make, that we had to really pray about and really decide what was going to work best for us. And I've never had surgery. I'm not huge on hospitals. Hubby, even though he is a RN and works in the medical field and works in a hospital setting, himself is not huge on hospitals for unnecessary treatments. And a lot of the time right now, I feel that at times a lot of hospitals treat birth as a condition as opposed to something awesome and amazing and life-changing and something that everyone goes through. It's kind of treated like it's a bad thing in a sense, and they always want to medicate everything, and I'm not really into getting medicated for everything. I try and avoid that when possible. So that was the decision I had to make. I don't want an epidural. I don't want Pitocin. I don't want anything that is going to, in my opinion, set me back. But this is all, of course, in my opinion. This is not me endorsing any one way for anyone else. One of the main things when it comes to birthing centers is that you have to also be in, has to be basically a ideal setting. If I was having multiples, I couldn't be there. If I had any sort of pre-existing condition or any condition that arises while I'm pregnant, so preeclampsia, which is high blood pressure, protein in your urine, those types of things, or if I have diabetes either before or if I develop gestational diabetes, I would not be able to deliver at a birthing center, because those types of things do need doctor treatment. They do need hospital treatment. But because as of right now, it looks like I'm having an uncomplicated pregnancy and will likely have an uncomplicated birth, it's okay to do it. The birthing center is within half of a mile of a fairly large hospital, Cedars-Sinai, here in Los Angeles. And my nurse midwife has the ability to work with different hospitals that she's gone to. So I'm confident that I'm going to get a very good experience. And just working with her so far has been really awesome. She's very sweet. She's been a part of over 10,000 births in her decades of experience. So for me, I was just very comfortable. I like the idea of having someone that wants to ask you questions. We spent like an hour with her for our first actual appointment at 20 weeks. In comparison to going doctors, you may spend 15 minutes and you may sit there for like an hour waiting for the doctor. So I really appreciate having that time just to ask questions and figure out, is this okay? I'm feeling this movement, you know, all that kind of stuff. And I really appreciate having the opportunity. But like I said, it is up to you what you're most comfortable with. I think part of the thing too was that I had only visited that OBGYN one time before I found out I was pregnant. So I wasn't necessarily comfortable with him. I hadn't developed a relationship. If you have an OBGYN that you developed a relationship, by all means, work with them, because that is someone you're comfortable with. They gonna see everything. So you need to be very comfortable with the fact you're gonna open your legs and stuff gonna come out and you're not gonna feel awkward. I don't feel awkward around our midwife, and I definitely think this is going to be an experience that we can both appreciate. And I've loved the idea of water births. I wanted to try it in birthing centers. A lot of hospitals are starting to offer it. And one thing you can consider is midwives do sometimes work in medical groups that actually operate out of hospitals. So they can work in a hospital as well. You can have a midwife. They have those here in California. I'm pretty sure they have them in other states as well. So all these decisions are completely up to you. I always say just do your research and do your research on what's most comfortable for you. So we even had to do some specialist appointments with a perinatologist, where they're just checking to make sure there's no sort of birth defects or anything like that that looked to be present. And I really liked her. She was an awesome OB. And if we were considering having a traditional hospital birth, I would have actually possibly moved over to her, because I really liked her bedside manner. Her care was very on point. She was very nice, very sweet, and asked a lot of questions, and was definitely interested in what was going on with me and my husband, and I appreciated that. So it's completely up to you what you want to do. Like I said, I am not endorsing for anyone else one way or the other. I'm only endorsing this as the way that my husband and I chose for us, because of what we believe for, what we're praying for, and what we're most comfortable with, in person that we're most comfortable with. So when it comes down to your pregnancy, I definitely say pick someone you are comfortable with, whether that's a nurse, midwife, I forget how they call it, but basically like a licensed midwife that's just only been a midwife, or an OBGYN. It's totally up to you what's most comfortable for your body, for your future, your child, you know, and for your labor. So make that decision on your own. But yeah, so the decision we've made is going with the birthing center, going with a nurse midwife. But in the end, towards the end, we have to meet with an OB, because just in case some complications do arise and we do have to be transported to the hospital, they want us to be comfortable with whoever is going to be the one who does deliver the baby and works on me whenever that time comes. So that's what I have to say about that. If you guys have any questions or want to know where I looked, how I got my information, the different sources, the research that I did, feel free to ask me questions. I'm here to help, here to answer anything that you have. And I will talk to you guys next week. Have a great weekend.